So we have our day one pelvic rotation test assessment here. What we can see in this golfer is he does a decent job of rotating the pelvis towards the right. Um, so he gets to the right, and here we're cueing both directions. So we want him to rotate in both directions, but to him that's just rotate a little bit to the right, and we don't get much left. So here, after I really say go left, 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 we were able to get a little bit of that left rotation. But we see kind of how difficult that was. So here it said, hey, go left as far as you can. This is what it means to go left. Good. We see that we get a little bit of action here at the trunk, and we have to work really hard to get there. So we see that the trunk kind of starts to break a little bit, which early does a pretty decent job when he rotates towards the right. So we don't get too much trunk action here. We see a little bit of kind of side flexion kind of coming when he is compensating and trying to work through that pelvic rotation, but overall pretty decent. The moment we have him go to the left, right there, we start to kind of break, and then here we've kind of lost our pattern or our ability to create that separation. So there's a lot of cognitive effort happening here to go left, and he's able to kind of hold it and sustain it before things really start to break down on him. So it's not smooth. We can't go left into right and back and forth without really having to think about it and work through it. And again, we see how that trunk starts to break a little bit there. Now, if we look at our modern day here, already you can see kind of smooth left to right action. So we're already getting into that left hip pretty decent, and that pelvic rotation towards that left side. So we have a pretty smooth, apologize for the skipping there, pretty smooth left into right action through there. Now we are getting just a touch of hiking still, and we can see just right there at the end, a little bit of that trunk coming along for the ride. But overall, right there, we see that the trunk does a good job of staying oriented down towards the ground, not rotating with the pelvis. And we do a decent job. So this is after about, I think, 8 sessions, we can see the improvement in that pelvic rotation from before. So he had done a decent job of the pelvic rotation test to start, but we definitely noticed some asymmetries, especially going into that left side. Some shake and bake, right, is kind of difficult. Cognitively, those muscles didn't like being addressed specifically to create that action of that pelvic rotation with a stable trunk on top of it. And then we can see through here much smoother, quicker, easier, and even a little bit of sagittal plane action here, of a little bit of extension even of that pelvis, which isn't exactly what we're going for. We see a little bit of a new movement, right? He's just gained so much more control over that pelvis at this stage so far.